All right, we are continuing our discussion on our digestive system. This slide is just summing up what we discussed in the previous video. Just remember, digestion is the processing of food to its chemical components so it can nourish our cells. The abdomen is the second major body cavity next to our chest. And don't forget the various different quadrants in which we can break it down to. So don't forget to kind of familiarize yourself with which organs are in which parts of the abdomen. Outside of the abdominal region, we also have our mouth, our lips, cheeks, gums, teeth, tongue, so on and so forth. They help facilitate the mechanical breakdown of food before we swallow it. In our mouth, we have salivary glands that secrete a variety of different enzymes that start breaking down specific components of the food that we consume. So when it gets to our stomach, it's already softened up, kind of like using a pressure cooker on chicken before you shred it. It just helps make the physical breakup of the food easier. Then when we were talking about airway, we have our oropharynx or our oral cavity. Then when we swallow our food, it goes down our esophagus, which runs parallel with our trachea. Then the esophagus ends at our stomach. Then we have our pancreas here, which secretes hormones that signal sugar storage in our body or even sugar release when we need it. And we'll talk about that when we talk about type 1 and type 2 diabetes. The pancreas also secretes other digestive juices and enzymes, but you do not have to worry about those functions. Just start thinking about the hormone insulin. If you're diabetic or know anyone who's diabetic, insulin is a hormone that facilitates sugar storage in our bodies. We have the liver, small intestines, and the large one as well. We have our appendix, then our rectum, which is the final passage before we go to the bathroom. Our appendix is a useless organ. It resides in the right lower quadrant of our large intestine. Back in the day, it's actually effective in primates who have leafy green diets. In humans, we don't have heavy leafy green diets like primates do. And what the appendix does for us is that it just sits there, accumulates some bacteria, gets infected, inflamed, and makes us sick. So appendix is just extra tissue that over evolution has become useless. So as I mentioned, we have enzymes, and they help facilitate the breakdown of food. So in our saliva, our stomach has some of the enzymes that our salivary glands put into our food become activated in the stomach. Our liver, pancreas, and small intestine also have some of these enzymes, and this helps also facilitate the chemical breakdown of food. And that gets broken down into basic sugars. So I keep saying glucose, that's a basic sugar. we have fatty acids and amino acids. So fatty acids are an energy storage vesicle. Then amino acids are the building blocks in our tissues and proteins. Then wherever these things are needed, they get processed further in the liver, and then they circulate throughout the body. And whichever cells need them at any given moment, it gets delivered via the bloodstream. You do not need to know the specific names of enzymes. There's a lot of them, and they're not necessarily the most relevant to emergency situations. The big thing is just understanding that enzymes help facilitate both the physical and chemical breakdown of the food that we consume. And so, to wrap things up, just again, familiarize yourself with the quadrants of the abdomen and the different organs that reside within those quadrants and just their general functions that I already discussed in the previous video. Because again, understanding the general function and where they are will provide much more information when we're assessing our patients both for trauma and for medical emergencies.